This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved. Hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do. This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Welcome, everybody, to Yeah, We're Going There with Dr. Natalie. Today's topic is going to be on diastasis rectus abdominis. What is that, you may ask? Well, if you recently had a baby, you've heard about it. But postpartum moms are not the only ones who get it. So let's get on with it. Raise your hand if you've looked down at your stomach post-baby, or honestly, post-nothing, just existing, and thought, why does my belly button look like it's trying to escape my body? That's not just mom pooch. That's not just getting a tummy tuck and move on. That is very likely diastasis recti. And today, we're going there. We're breaking down exactly what it is, who actually gets it. Spoiler, it's not just postpartum women, as I said, and what actually fixes it. Let's start talking about the anatomy, because I think this gets skipped, and it's the whole reason this makes sense once you understand it. Down the center of your stomach, connecting your left and right six-pack muscles, you've got this strip of connective tissue called the linea alba. Think of it less like a muscle and more like a zipper. It's tough, it's flexible, and its whole job is to hold your left and right abdominal wall muscles together, transfer force between them, and give your core something to brace against. Diastasis recti happens when the zipper stretches out. The muscles pull apart down the midline, the connective tissue thins, and you get that visible bulge or coning or doming, especially when you sit up, cough, or brace something heavy. And I want to be really clear about something. This is not a hernia. It's not your organs falling out. It's a structural change in that connective tissue of the zipper that shows how your core transfers load from one side to the other. If it's left alone and untreated long enough, it absolutely can set the stage for things like an umbilical hernia down the road. So it's just cosmetic is not the full story. This is where I want to push back on the narrative a little, because diastasis recti gets filed under a pregnancy thing and left there. It is overwhelmingly associated with pregnancy, multiple pregnancies, carrying multiples, the hormonal and mechanical stretch of a growing uterus. That's real, and that's the most common path, but men get this too, genuinely, quietly, and undiagnosed a lot of the time. If you're straining through heavy lifts, deadlifts, sit-ups, without your deep core actually engaging, that connective tissue or the zipper takes the hit. Add in weight fluctuation, aging, where your collagen just does naturally decline, chronic coughing or straining, or if you have a genetic predisposition to weaker fascia, which is the tissue that connects both sides, and you've got a guy in his 40s wondering why his stomach looks off, and nobody's ever mentioned diastasis to him as a possibility. Even men who are very fit but lift very heavy without proper form can also have this. So who gets it? Anyone whose abdominal wall has been under sustained outward pressure, like with pregnancy, weight change, straining, aging connective tissue, or all of the above. What it actually feels like, not just looks like, is that vertical ridge or doming when you go to a sit-up can contribute to low back pain because your core isn't stabilizing your spine the way it needs to. You may have a general sense of my middle just feels unstable. You may experience pelvic floor dysfunction, incontinence, heaviness, because remember, your core is a system, not a muscle, and your pelvic floor is actually a major component of your core. Everyone assumes it's just the six-pack, but it's not. Your core is made up of the deepest of the abdominal muscles called the transverse abdominus muscle on the front side. It's like the corset muscle that holds everything together. On the back side, it's made up of the deep spinal muscles that are in between the vertebrae. On the top side, by the breathing diaphragm, and on the bottom, by your pelvic floor muscles. They all work together to create a stable foundation for the rest of your activities. And when one part isn't working right, it will affect all the other parts. Some other things that you may feel or experience if you have it is bloating and constipation, digestive stuff that people rarely connect back to a diastasis. Do you have a diastasis and don't know it? You could do a quick self-check right now, lying on your couch. I'll tell you how. Lie on your back, knees bent, feet flat on the ground. Your fingertips, hold them horizontally at your belly button. Then, from a lying down position, curl up, lifting your head and shoulders slightly, like you're doing a mini crunch, and feel for the gap between your muscles. 2 or more finger widths means that you most likely do have a diastasis rectus abdominis. As you curl your head and your shoulders up for the crunch, if the distance narrows or the muscles, you feel them coming closer together to less than 2 fingers width, or your fingers that were initially kind of sunk in now are getting pushed out so that they are sitting less deep in your abdomen, then you're probably safe. I really want to spend some time on the postpartum piece. This is important and why you can't rush getting better. This is because, and I think this is where the most unnecessary panic and the most unnecessary surgery consults occur. After delivery, your estrogen and progesterone, which were 10 to 100 times their normal levels while you were pregnant, will literally crash within 24 to 72 hours of delivery. That crash is what will kick in your lactation into gear if you plan on nursing. That drop in estrogen will also have a direct effect on your connective tissue healing. Here's the chain. Lower estrogen means less collagen and elastin projection. Less collagen and elastin means your linea alba, that zipper we talked about, has a harder time recoiling and tightening back up. Add in the lingering, softening effects of relaxin, another hormone coursing through your body when you're pregnant, and shortly thereafter, your body is hormonally working against a fast closure of that gap. If you are nursing, the window for healing can stretch out even longer because nursing can delay your cycle returning. It can keep estrogen levels suppressed for longer. So this is what I tend to tell my patients. Your core rehab is going to be most effective once your hormones start stabilizing again, which for most people is somewhere in the area of 3 to 6 months postpartum, or if they're nursing, hormones may not normalize for 4 to 6 months after they're done nursing. If you're 6 weeks out and panicking that nothing's working, nothing's supposed to be fully working yet. That's not failure, that's biology. So be kind and patient with yourself. Okay, the part you're here for. First, what not to do. Traditional crunches and sit-ups. I know, but that repeated forward flexion or forward bending, high pressure movement is exactly what worsens the separation. Same goes for holding your breath through anything that's a challenge. If you're straining, you should be exhaling instead. If you're doing something difficult, think blow as you go or exhale with effort. What actually does work is rehab that targets the deep core muscles. You need to learn how to engage the deep core muscles we talked about earlier. They all need to learn to work together. And if you're not sure how, seek a pelvic health physical therapist even a personal trainer. Once you know how to engage the deep core muscles, then add in arms and legs into your exercise so the body can learn or remember how to transfer force through that linea alba or zipper and prevent the coning and the doming and just be a stable base for anything you may be doing through your daily life. So let's give some examples of some exercises you could be doing. One that I like is toe taps, lying down on your back with your knees bent, feet flat, core engaged, which you'll learn how to do, and not so easy to explain how to do that here on this podcast, but hey, let's go for it. Let's try. I want you to put your hands on your abdomen so that the thumbs are at the base of the lower ribs, your pinkies are on your hip bones, and the other four fingers kind of rest on your belly. I want you to draw your belly in, and you may feel that your pelvic floor is contracting as you do that, and you may notice that your pinky and your thumb, the distance between them may get smaller. Now, you're going to continue to breathe. Breathing's important. And you're going to engage or keep that contraction. You're holding it. Okay? And then you're going to alternate lifting one leg, tapping the toe down, then lifting the other. You're alternating that pattern. Another exercise would be a heel slide. So as you just did, you would engage that deep core muscle, making sure your low back is stable. Slide one heel out, bring it back to a bent knee position, then slide the other heel out. And what you're really looking for here is that those hip bones are not tipping from side to side as you do the exercise. Another great exercise for your core is a modified plank or a bridge. What it helps do is build tolerance without dumping pressure straight into that midline. And it's super important to always remember to breathe. Diaphragmatic breathing or belly breathing isn't a bonus. It's foundational. And it's how you keep the deep core system, the diaphragm, the pelvic floor, the transverse abdominus, all working together instead of fighting each other. Daily life matters too. And this is the stuff that quietly undoes people's progress. Roll onto your side before you push up out of bed instead of crunching straight up while you hold your breath. Bracing your core before you lift anything, including your toddler or the car seat or a heavy bag of groceries. These aren't small things. They're the difference between reinforcing the gap or reinforcing the repair dozens of times a day. And if conservative care genuinely isn't enough, surgical repair exists, sometimes paired with a hernia repair or a tummy tuck to suture that connective tissue back together. That is a legitimate option for the right candidate. It is not the first option that you should jump to at 6 weeks postpartum because your body hasn't even had a chance to heal. So why don't you just live with it, some people may think. If this goes unaddressed long term, here's what you're actually setting up. Low back pain and hips will start to overcompensate for a core that isn't stabilizing. Hello, chronic pain. Your pelvic floor will take on a load it's not built for, resulting in prolapse or incontinence. That thin connective tissue, the linea alba, will genuinely become a weak spot for potential hernia to develop. And a lot of people are walking around with chronic bloating, constipation, never once connecting it back to their abdominal wall. So this isn't vanity. This is function. If you've checked yourself and you feel that gap, or you've had that something's just off feeling for years, but never had a name for it, that's your sign to get evaluated by a pelvic floor physical therapist. This is a deeply fixable situation. It just requires the right approach, not the fastest one. If this episode helped you understand your own body a little better, that's the whole point of this show. Follow, share it with someone who needs to hear it, and I'll catch you at the next one. We're going there every time. Thanks for being here today. See you next time. Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there because knowledge drives better health. This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full-spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel are clinically tested and OB-GYN approved. Hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do.